Prognosis for type 1 diabetes. If type 1 diabetes is left untreated, the prognosis is fatal due to diabetic ketoacidosis. DKA is a serious complication that can lead to diabetic coma or death. It occurs when your cells do not have enough glucose needed for energy, so your body burns fat to produce this energy, thus producing ketones. The incidence of micro and macrovascular disease can be drastically reduced with controlled type 1 diabetes for up to 30 years. If uncontrolled, it can lead to chronic complications such as kidney failure, heart attack, blindness, or amputations. A few years of strict glucose control yields reduced chances of micro or macrovascular complications for up to 10 years later. Acute complications of diabetes was the leading cause of death before the age of 30 for those diagnosed with type 1 diabetes before age 15. After 30 years old, cardiovascular disease, such as heart disease, stroke, peripheral artery disease, was predominant in addition to acute complications. Poorly controlled type 1 diabetics reduce their life expectancy by more than 20 years. 15% of type 1 diabetics will die before the age of 40. A quick mention regarding prognosis for women with type 1 diabetes in regards to pregnancy. Women with type 1 diabetes are 5 times more likely to experience stillbirth. Their babies are 3 times as likely to die within the first few months of life, and they are twice as likely to have congenital anomalies. With careful planning and treatment, they can go on to have successful pregnancies. In either case, with type 1 or type 2 diabetes, strict glucose control lowers your risk of having these complications in a great significant amount.